Folks living with obesity are at a greater risk of developing clinical complications as well as poor prognosis and severe influenza, pneumonia, and COVID. Immune and metabolic dysfunctions associated with increased susceptibility to flu and the like are linked to obesity-associated low-grade inflammation, compromised immune and endocrine systems, and high cardiovascular risk. Good morning, friends. If you don't know who I am, my name is Jessica, and I engage in conversations about weight loss, weight-related disease education, and how to achieve weight loss in an affordable way that honors our way of living. This weekend, I read an article that was very interesting, titled COVID-19 and Obesity, the overlapping of two pandemics. I thought that was very interesting. In this article, which is supplemented by a secondary article of the same year, they both really emphasize that adipose tissue is a metabolic active organ. Therefore, it can impair metabolic and endocrine processes, leading to systemic low-grade inflammation. These alterations set the stage for metabolic and cardiovascular complications such as insulin resistance, diabetes, atherosclerosis, hypertension, and many other cancer types. Most importantly, it can affect the immune system. We have discussed this before, so I'm not going to get into it, but obesity emerged as an important risk factors during the viral infections through the years, not just because of its persistent pro-inflammatory condition, but also due to its associated metabolic complications and comorbidities. Altogether, these factors play important roles in worsening viral infections. Better understanding on how these conditions contribute to COVID-19 and influenza severity may help decision-making processes at patient screening and management, since early interventions is really the key to prevent mortality. Besides, it may support formulation of health policies and hospital bed projections, specifically to the ICUs and wards, right? Based on the recent pandemic, it will be essential to establish stricter surveillance for viral detection and disease morbidity and mortality by developing therapeutic and clinical strategies for obesity-related mechanisms of pathology in COVID and influenza, pneumonia, as well as in other infections. We do have some sort of liable or some sort of screening when we do engage in anything to do with COVID right now. I mean, I do want to refocus that this is a 2021, both of these studies are 2021, which are really relevant, but at the end of the day, the numbers and everything has changed. Additional therapeutic and nutritional interventions focused on adipose tissue, such as medications and supplements contrasting the inflammatory state of obese patients, could decrease the risk of developing the severe form of COVID. Obese individuals, as well as other subjects with abnormal body composition could require tailored medical diet therapy in order to improve both short and long-term COVID outcomes. Obviously, both papers' conclusion was that overall obesity displayed a strong correlation with critical illness and major severity of COVID-19 manifestations. Severe acute respiratory syndrome and coronavirus 2 is responsible for COVID-19, has so far infected over 85 million and killed over 1.8 million people worldwide. Again, this is out as of 2021. The increased hospitalization and mortality linked to COVID-19 are associated with older age and a number of underlying conditions, which do include obesity. Obesity does seem to increase the risk of both COVID-19 complications and mortality. At the end of the day, I think that it would be useful to ensure that if you do have a higher BMI, that your sense of protection and maybe immunization would be something that I would recommend. Now, again, I'm not in a position to say that what you want to do is, or what you do is what you do. I am, while I am an advocate of vaccination. At the end of the day, you are the navigator of your own health. I do agree and consent, and this video was to emphasize that where our BMI is higher, the tendency to have the risk factors are there, therefore baby immunization would be warranted. And this is in the most compassionate way that I would encourage you to do. Not necessarily am I a stunt in at the end of the day, people are entitled to navigate their own health. So this is just a piece for fun, and the studies are just for us to be informed and at the same time have fun, and I wish you health and happiness.